You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, smile makeovers. According to my first guest, he says small improvements made to your smile can make a big difference in not only how you feel about yourself, but how others perceive you. With us, we have Silicon Valley's cosmetic dentist, Dr. Ramin Moradi. Dr. Moradi, welcome to the program.
Thank you. Great to be here.
So before we get into today's topic, who's a typical patient and what are the different services that you offer?
We're a general practice, so we do see all walks of life, and we see all different facets of dentistry under the same roof. We have patients that come in for a whitening procedure, for instance, just to freshen up their smile.
You do everything there. I guess you have a concept where you rarely have to send patients out.
That's
so you have
right.
trained in root canals and
That's
extractions.
Right. I love many different facets of dentistry, so it is enjoyable for me to do different things at different times of the day. So I don't like to be boxed into just doing one type of work. We just like to make everything as nice as it looks. That's where the cosmetic aspect of it comes in. But I think ultimately, I got into general practice because I enjoy most facets of dentistry. If there is something I don't like, I probably wouldn't do it at the office.
Yeah, you were telling me in the green room, you love it.
Yeah.
Now, you really think it changes people's lives?
Absolutely, I do. If I wasn't so passionate about it, I wouldn't be here talking about it. It really is something that I think most patients don't realize how impactful it can be until they have something like that done to them. There's little psychological things that play in on how you smile, for instance. You see some people that never smile.
Yeah.
And you start delving in there a little bit and you realize, it may be a small little crack or a little discoloration or something like that. And someone that's very attractive otherwise is walking through life with a very stern, face. And once they open up their mouth, that shows you a lot about how impactful this can really be. When you take someone that just isn't happy with their smile, and some of it may be psychological, some of it may be that they are aware of what the problem is, but when you take that person and you give them that smile that they've always wanted, you're going to have someone that's now smiling more, just has a whole different outlook about how things are. I've had patients where I had this one gentleman, he's a part of a big family, and I've treated most of his brothers, and these guys are all in their 50s and 60s by now, but he was like the older brother. He was the one that was taking care of the whole gang and whatnot, and he had these teeth that kind of crossed over one another. Good looking guy, nice hazel eyes, really charismatic looking, but you would rarely see him smile. And he'd had a bunch of old dentistry on these teeth, and that added to the fact that you would rarely see him smiling like that. And finally it got to the point where his wife kind of gave him enough nudges that he decided to get something done about it, and we gave him some veneers on the front teeth. And his wife comes in the other day and says, I don't know what I've done, I've created a monster. now he's going around smiling at all the girls. I can't stop him anymore. So it really is a life-changing thing. And this guy was a very good-natured guy. It wasn't like he wasn't personable. It was just that you would rarely see him smile. And when people don't smile, unfortunately, the other side is judging them on that. This guy may be a very friendly, very nice guy, but when we don't see a smile on the person that we're talking to, we're feeling like either he's in a bad mood or something against me, or
Yeah.
So it is amazing to see what that, I wouldn't call it a little thing, because it is a very big thing when you get them to smile.
So there are a lot of people, like where you are, that hate their smile.
Well,
like they admit this on the consult. Like they never like their smile.
There are a lot of people that are unhappy with their smiles, and there are a lot of people that they go on through life. And I think as a dentist, it's our job to let them know what is available, because a lot of times they don't know what's available, or they think that it's going to be too expensive, or it's going to be too time consuming, or things like that. And with modern dentistry, with the materials we have today, we have some amazing treatment that can be done literally in 1 or 2 visits.
Okay.
So,
now I know that a cosmetic dentist isn't a recognized specialty, but you've had a lot of training in cosmetic dentistry. Tell me about that.
well, I come from a very artistic family to begin with, so arts was something that I was always very interested in, even outside of dentistry. So once I got into this field, a very technical, a very mechanical type of profession, it took getting into cosmetics to kind of bring science and art together for me, and to satisfy my need to express myself. And people think of cosmetics as just veneers or something that's very visible, but I think what I always judge my work as is, I want this patient, if they ever walk into another dental office, for that dentist to be the one to tell them what a nice job this is. Because patients, for the most part, they don't know what you're doing in their mouth unless it's right there in the front. And even there, it's subjective as to good work, excellent work. But everything we do, we like to put that little bit of a cosmetic twist on it, just because, we like to try to give that extra attention to each patient.
Now with veneers, you brought up veneers. It seems like veneers can be big and bulky. And I told you in the green room, I feel like I could spot veneers walking down the street.
Yeah.
Is that, and we've all seen the shows where somebody with the big giant teeth, is it the cosmetic or the dentist that did it, or is that what the patients are asking for? What's your take on that?
I don't think the patients are asking for it. I mean, you get some pretty eccentric personalities once in a while, but I think when you have something that looks bulky or it doesn't look right, it probably wasn't a job very well done. Now, it could be kind of combination between the dentist not having the proper training, doing what they're doing. It may be that the patient might be thinking certain things about how they want this done. I think ultimately the best cosmetic work you can do is one where it's not visible truly to the patient and to the people that see those. I like to have it where the family members don't really know what's happened there, or their friends, they see them and they think, you look like you've been on vacation or something.
Really? They don't notice their new teeth sometimes?
If you do it well enough, there really shouldn't be a big difference in that sense where you're seeing the patient walk in through the front door. You want it to look natural enough where it looks like a beautiful smile, but you're not going to pinpoint it and say, oh, nice veneers, or, something like that.
So has cosmetic dentistry, because of the materials, things like that, become more affordable or accessible to people?
Well, yeah, there's a lot of materials nowadays that mimic the natural dentition so well that you're not having to veneer every single patient that comes in through the door. You'll have patients that have like a little gap in the middle of their teeth, for instance. It's been bugging them forever. But they think in order to get that taken care of, they're gonna have to veneer everything. And it's
but there are dentists with that philosophy as well, right?
Well, yeah, there's a lot of different ways to treat a certain situation. But myself, I really like to be a little bit more conservative, because nothing really replaces your own teeth. Okay. So if you can do the work, get a nice result, and do it on a level where it's both cosmetically pleasing, but at the same time you're conserving tooth structure, that I think is the best balance of it.
So let's talk about porcelain veneers for a moment. If somebody goes in on a consult, how do they know what their teeth are going to look like? I mean, what's that process like?
Well, that's a great question, because what I see their teeth ultimately looking like and what they see their teeth, wanting their teeth to look like, could be totally different. So the best way to prevent any kind of miscommunication, prevent any kind of unexpected results in the end, is to have it where what we do at the office is we'll take impressions, models of their teeth, that's sent over to the lab. They'll do what's called a cosmetic wax up.
Okay.
They'll basically do a revamp of the area that we're trying to work on with the patient. They'll come in, take a look at it, make sure they're happy with the results there. Once they give us the okay and we've worked on their teeth, they will be temporized in that new look based off of that wax up.
So you give them like a try-in smile kind of
Exactly.
thing. Okay.
They get to walk out with that. They get to try it out for a week or two, make sure that they're happy with it. And at that point, you know, if they wanted the teeth longer, shorter, rounder, squarer, all of that can be achieved. And what that allows them to do is really have a pretty good amount of time to make sure that they're happy with what they're getting, so that once the final results come in, they're only going to look that much better because they're made out of porcelain versus the plastic, which the temporaries are.
So they start with those teeth, and then you order the porcelains and then put the porcelains on.
Exactly. And you know, once we've kind of come up with a plan as to what we want in the end, that's what's relayed to the laboratory, and that's what we get back.
Now, at the top of the show, we said, change your smile and you could change your life. Sounds like a bit of an overstatement, but you see that in your practice.
Yeah, absolutely. There's one patient that comes to mind, and this guy, he was part of a larger family and a bunch of brothers, and they're always just cracking jokes, and they're all characters except this one guy. He's just blank slate, and I'm always wondering, how can it be you're all from the same family, but he's just so different from all of them. And over time, he became a patient of mine, and only after we started to work on him did we realize that he didn't like his smile. And because of it, he never smiled. And everyone thought this guy is just such a stiff guy compared to his other brothers, because all of them were always laughing and cracking jokes and everything. And this guy is just very, very serious. And he told me, you know, I never saw. And the funny thing is, when he came to our office, we take him into the room and he gets a little bit more comfortable with us. I look at his teeth, and they're not that bad. But he's had to live with these teeth, and he's just sat there and gone over every single defect that he has, and he's come to the point that, you know what, I'm not going to smile anymore. And it took literally, I'd say, a month after we fixed his teeth. You would see him in the mirror kind of smiling here and there. You're thinking, what is he doing? But he was kind of coming out of his shell, and he was becoming his own person, and it's incredible to me.
So he's like all of his other brothers now.
Yeah, he's like one of the head characters.
Except for his teeth are better than theirs, I hope.
There you go, that's right.
And now, when they see their teeth for the first time, some people get emotional.
Oh yeah. I get emotional sometimes when I see their emotions, because it is incredible. You know, someone that's been hiding their smile for all these years because they were so uncomfortable with it, and then you hand them that mirror and they start crying. And
is that right?
It just hugs all over the place, and it's a beautiful thing. It's beautiful to be able to do this for people. And you know, compared to most other cosmetic fields out there where you go in and there's bruising and bleeding and, you know, swelling and all this stuff. When you look at cosmetic dentistry, the guy goes, hour later, he leaves the room and he's like perfectly fine.
Great teeth.
And he's got beautiful teeth. So it's an incredible field.
Now, we talked about extreme makeover in the green room that I know one of the plastic surgeons on the show, and he said the teeth seem to change the appearance the most.
That's right.
And you had some comments about that.
I actually know some of the guys that are on that show, and I do know that when that show first started airing, the dentist was the last one that they talked to regarding anything, regarding picking the patients, anything. By the second season, the dentist was the one that was picking who the patient is going to be, because of the kind of transformation he'd be able to achieve for them relative to anything else that they were getting done, because everybody notices the smile. You know, you can do all kinds of stuff to your face, the powders, the lipstick, all of that. It all comes off at the end of the night, or hopefully it does.
Yeah.
Teeth are the ones that once it's done, you got it for another hopefully 15, 20 years. And it's incredible, because any other cosmetic procedure, be it cosmetic or not, where there's some sort of rehabilitation involved, I talk to MD friends of mine, doctors in other fields, and they say, you know what? Dentistry is the one where you can actually improve on the original situation, whereas with all other kinds of surgeries, you're hoping to kind of give them back a limited amount of their functionality.
Yeah.
You know, with dentistry, not only are you able to improve function in a lot of cases, you're able to give them a beautiful smile that they may never have had.
Now, it doesn't surprise me that you think it's important. You're a dentist. Of course you think the smile's important.
You know, I get that. I understand it, but take me out of the equation. There's a lot of surveys out there that they do on a regular basis to see what are the attributes that you look for in a mate. What are the attributes you look into for? And these are just everyday people that are doing these surveys, and the smile is always right there on top of the list, at least in the top 2, 3. It's incredible because there will be fitness magazines where you think they're going to be talking about muscles and this and that, and smile is right up there. When people are looking at you, they're either going to see your teeth or they're going to see your eyes. Those are typically the top two things that people will look at. You look at Hollywood, look at how important teeth are in just the way they try to make a character look a certain way. They want to make them look like the bad guy, they'll give them the darker teeth. They want to make them, they'll give them the shorter teeth, they'll give them the gaps in the teeth. All of these things are considered negative connotations.
It's like if you want to make somebody look poor in a movie, you give them bad teeth.
That's right. You're not going to have too many poor people with brand new veneers. But that's the idea. Is when you want someone to look like the bad guy, typically you're going to give them these what we consider less than ideal qualities when it comes to your smile, and that in itself shows you how important the smile can be. You know, there's been stories about, let's say, 2 twin sisters. They'll go in for the same job. They're in a job interview. They may even both have gaps in their teeth. One of them owns it, one of them is embarrassed by it. The one that owns it is smiling ear to ear. She's confident with what she's doing. The other one isn't. So as a result, she doesn't smile. That can make a big difference as to which one of them is going to end up getting that job. I had a young lady that worked with me for many years as the front desk person, who all I could remember is the whole interview she's smiling ear to ear, and it wasn't necessarily that she was that much more qualified than the other people, but she was so confident and so cheery that I knew that, you know, this is the kind of person you want there greeting your patients when they walk in. If someone's sitting there embarrassed about their smile, that doesn't come across as being embarrassed. I had another office manager who's still with me today. I love her to death now. But when she first came to me, she said, I'm too shy. And I said, you know what? That's not going to work here. You're going to have to smile, because when you don't smile, people take that as being rude. People take that as being standoffish. These are the things that are kind of associated with that. So thankfully, she started smiling more, and we've had her for about 15, 18 years now.
15 or 18 years. Have you had to fix her teeth at all?
I've done all her. She's actually now thinking about getting veneers. So next time you talk to me, I'm sure we'll be showing some pictures.
Now, what about your teeth? I mean, they look great. Did you veneer them?
No, I haven't had any veneers. I had orthodontics done when I was younger, so I've been blessed with having good teeth. But the beauty of it is, with what's available now in dentistry, everyone can do this. Everyone can have teeth as their
so are the patients getting older and older getting veneers, or they're getting younger and younger? Is it men and women? I mean, who's doing more of it?
You know, I would say as far as the men and women, it's probably 60-40, somewhere in there between women versus men. But it's becoming more and more the thing to do. And
it's like mainstream now.
Well, I think as more people are becoming aware of what's available out there, definitely you're seeing a lot of people coming in asking for it, versus before it would have been something that we would maybe suggest to them. Have you ever thought about veneering, or have you ever thought about whitening? It's now become something that's so, people are beginning to recognize the significance of a smile. So now they're coming in, you get people in their higher 40s, 50s. It's almost getting to that point where you reach a certain plateau and it's like, it's time for veneers.
What's your take on this? So for example, you see somebody and they've got the expensive car and they've got the Rolex and they've got the shoes and the belt and the bag, but they've got this old, and great skin and hair and nails, but they've got this old smile.
Yeah.
Or like I'll see a newscaster, a contributor on one of the stations with really bad teeth, and they're making a lot of money. Is it their fear of the dentist? And what's your take on these people that have the means but they do nothing about their old smile? What is it?
I think it's multifold. There is that anxiety associated with some people that want to get their teeth done. They're afraid that it's going to hurt. If you go back a couple generations, you had a lot of people fearful of the dentists. And I get it routinely where people will come in now and it's like, I can't believe that was a dental procedure. I mean, it was so easy.
Really?
When you're numb and you're comfortable and you got your headphones and the pillow and the blanket and all this stuff going, patients feel like they're at the spa nowadays.
Now, you use sedation in your practice.
Absolutely. And sedation has become more and more part of our practice just because you have patients that are fearful of going to the dentist. You have patients that are super busy, don't have time to go to the dentist. And you have some patients that just have put it off for so long that now they have a lot of work that needs to be done. And rather than coming in for the next 5 to 10 years to get it done, they come in, you sedate them, they're comfortable, you work on them, and they're done in that afternoon. I had a patient, he was a race car driver.
Okay.
He had a terrible back. He couldn't sit in the chair for more than 15, 20 minutes. We sedated him and we worked on him for 8 hours straight. Walked out of there perfectly fine, got all his dentistry done. Next time I saw him, he brought his kids over because now he wanted them to get their work done because they hadn't gone to the dentist in a long time either. But he saw how comfortable he was with the procedure. And the beautiful thing about sedation is that not only are you asleep and comfortable during the procedure, you wake up and you don't remember what happened.
Okay.
So even if it wasn't such a great experience the whole way through, patients don't remember what happened most none of the time. So they leave that place. They think it was the best dental treatment they ever had, and they have a brand new smile.
Do people tend to do cosmetic dentistry, fix their smiles because of occasion or like a trigger? Something happens.
Lots of times, sure. Weddings, they want to look good for their weddings. Divorces, they're getting back into the scene again. They want to look their best. You'll have a grandfather where the grandchild is telling them, "Grandpa, your teeth look dark," or you're missing teeth in the back, or they'll come in and they say, "You know what, my grandchild
Is
saw
that
this."
right?
Yeah, and that's what they've had it all along. They were perfectly okay with it, but then once someone triggers that notion, that's when they start coming in.
So there's a term, instant orthodontics. What does that mean?
Instant orthodontics is where you have patients coming in that, let's say, they'll have some crooked teeth going on. As we get older, typically our teeth start to jam into one another in the front. And
So those lower teeth seem to get crooked first?
That's right.
Is that right?
You'll
Okay.
see it on the top teeth as well. It's just a forward movement of the teeth as you get older. Everything is changing. So instant orthodontics is where you have someone that's got these crooked teeth, doesn't like them, can't clean them as readily as they want to. They come in for an afternoon, they get their teeth veneered on the bottom. Nice straight teeth is what they walk out with. It's typically a 1 or 2 visit procedure, depending on what we're doing. The other option is going through adult orthodontics, where you're doing Invisalign, for instance, clear retainers. Typically, no one sees you wearing it, but these are as effective as braces, and what they're doing is each aligner that you get, each retainer that you're getting is getting your teeth one step closer to that final straight position.
Okay.
Sometimes you do a combination of both, you know, depending on if the person has a lot of wear on their teeth. But rather than grinding away all the tooth structure to put these restorations, we get the teeth straightened out, and then with the veneers, you're able to give them a beautiful new set of veneers to cover those straight teeth.
And veneers don't stain? Is that true?
Veneers don't stain. Porcelain doesn't stain.
You don't have to brush them?
You do have to brush them. You take care of them just like your own teeth, which is very nice. There's no special care really needed. As long as you're taking care of them, brushing, flossing, they should last you for years to come.
We're out of time. Final message. Somebody watching this, they don't like their smile, right? But for whatever reason, they're putting it off and putting it off. What do you say to them? Or maybe they're afraid of the dentist.
I say do yourself a favor and come in even for a consultation. Just find out what your options are. And that's something that I always have told patients, is that you'd never know what you don't know. You know, if you don't know what your options are, you're always going to feel like, oh, I can't do this, it's going to be too expensive, it's going to be too time consuming, whatever. There are so many different ways to improve your smile that it's incredible to me that you still have patients coming in and you tell them about white fillings. Oh, they do white fillings now? Absolutely. Absolutely. So just come in for a consultation.
Okay.
Just find out what is available to you. You may decide not to do anything at all, but at least you know, or at least that may be the spark that you needed to get you kind of going on that journey, if you will.
Now these people, you fix their teeth. We talked about it in the green room. And now they're doing selfies on Facebook and on Instagram and driving all their friends nuts. Right? You see that?
Absolutely, absolutely. You know, when you have a nice smile, it's almost contagious, and you can't keep it hidden anymore. You know, the people, just the same way as the people that are embarrassed about their smile, you'll always see someone looks very attractive, everything looks right, but every time they're smiling, it's just lips. And there's always something under there, you know.
So you can spot that as a dentist. You can tell that person doesn't like their smile.
I think if you're on Facebook or any of these, you can see it yourself. You'll see the patient otherwise perfectly attractive, but
they never smile with their mouth
smile
open.
with their teeth showing. And
that's a good point.
You know, and some of them, you see them with their teeth and they don't look half bad, but there's something there that keeps them from being proud enough to want to display them. You know, it's an amazing field to be in.
So you can end all that in one day, one afternoon. Go in there, get sedated, wake up, and you got great teeth.
There is some amazing treatments you can do. Not all in one treatment, but absolutely. There's some amazing things that can be done in 1 or 2 appointments nowadays.
Okay, good. I want to thank you for coming on the show. Very interesting.
My pleasure. Nice
Appreciate
to see you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.